Hi everyone, welcome back to my YouTube channel. This is Dr. Sara Ionescu, and today I wanted to talk all about my journey with chronic low back pain. So this is something that I struggled with in the past, but I have actually been able to essentially completely resolve for myself. And because I was able to do that, I wanted to explain my journey and what happened because I think it may be helpful for others to hear. So I think it was the summer between freshman and sophomore year of college, I worked as a lifeguard. And the beach that I worked at, the lifeguard towers were actually quite tall. They were 12 feet or so in the air. And we were coming back from a break and I was climbing the lifeguard tower. I was only using one hand on the rungs because I was holding a handheld radio in the other hand. Someone on the stand said something to me and I turned around to respond to them and I lost my balance and I fell backwards probably from about 10 feet and landed on my back on the sand. Luckily, I was wearing a backpack that was full of warm clothing for when it got breezy up on the lifeguard tower. So I had like a sweatshirt and sweatpants. So that did cushion my fall a little bit, but you can imagine from 10 feet, the wind got knocked out of me. It took me a minute or two to get up. Luckily, in that moment, everything felt fine. I had no immediate pain, no apparent injuries. I was able to get up and continue right along with my shift. And really, the next, year or so, I didn't have any apparent issues from that. I was able to do all my normal exercise activity. I was still on the swim team in college. Everything seemed like it was going fine. However, over that year, I also gained probably close to 30 pounds. And as that year sort of came to a close, I started to notice I was having some low back pain. And at first I wasn't sure what it was about. I thought, oh, maybe I slept wrong or I did, a little too much weight when we did leg day, whatever it was. So I kind of just blew it off at first. But then it started to get worse and worse. And then I started to have leg symptoms where I was having numbness and tingling going all the way down my right leg into my toes. And then I started to notice after sitting for a long time, because in this period of my life, I was in college, but I was studying for the medical school entrance exam, which is called the MCAT, which is a very lengthy exam that requires, as you can imagine, lots and lots of studying. So I was doing a lot of sitting. And what I noticed is after extended periods of sitting, when I would go to stand up, I could barely put weight on that right leg because of the pain and the numbness and the actual weakness that I was having. So, of course, because I was a college student, I was studying, I was an athlete, I kind of delayed getting this addressed. And it was actually the day that I took the MCAT when I had to sit for basically 8 hours straight. And then I stood up to walk to the car and I truly could barely walk. I was hobbling, I was limping. And it was, okay, it's time to go get this addressed. Well, after a few different visits with different specialists and having an MRI, it was determined that I had a herniated disc. So the disc is the shock absorber that sits between the bones in your spine, which is called the vertebrae. And what happens is the disc herniates, or it kind of squishes out from where it should be. And when it does that, it presses onto the nerves in your spine. And for me, it was pressing on the nerves that go down and supply the right leg. And so that's why I was having those symptoms. So ultimately, for me, it was determined that the best course of action would be surgery to correct this. And if you are someone that is having this type of issue and this is resonating with you, schedule an appointment with your doctor right away if you have not sought care. These are definitely things that you need to talk with the doctor about right away. And you want to make sure it's your personal physician that knows you and knows your body, and you guys can come up with a plan for what the right steps are. There are many different ways to treat this, and it is very individualized. So for me, the ultimate treatment was surgery. So I had surgery to correct it, which was actually quite effective, and I felt significantly better afterwards. But what I found was over the years with different weight fluctuations, When I lost weight after college, I felt much better, but then I had more weight fluctuations with pregnancy and postpartum and recovery and pregnancy again and all of that. I found I chronically was having issues with back pain, and it was almost always there to some level. Some days it was just a little bit bothersome, but there were days I can think of when I was, going into the hospital for my residency shifts where I would wake up in the morning and I could barely stand up straight, and I was having to do stretches, before I left the house so that I could be in a more functional situation to be able to go to work and do what I needed to do. So at some point along the way, I realized, okay, we need to get control of this because I'm young. At this point, I had one child, and I thought, I don't want to live with this forever. I need to get things under control. So when I started thinking about this was actually around the time that I delivered my second child. And I had some pretty significant pelvic floor issues. And so I was referred for pelvic floor physical therapy. And when I spoke to that physical therapist and explained all of my history, she said, well, actually, a lot of what we're going to do is probably going to also help your back. And I thought, okay, well, that would be wonderful. And so, of course, we started with a lot of deep core exercises because that ties into your pelvic floor. I also had some issues from pregnancy where I had what's called a diastasis recti, where the abdominal muscles are separated. And so you do a lot of deep core to bring that together. And what I found was she was absolutely right. With doing those deep core exercises, I started to see major improvement in my back pain to the point that it almost seemed non-existent. And when I sat down to make this video, I started to really think about what are the things over the years that have helped my back pain and that have continued at this point to keep it away for years. And so it's really three things that were the most important for me. One was those deep core exercises, which some examples of these are 360 breathing, which if there's interest in this, I can definitely make more videos to go into detail about how to do these things and exactly what they are. But so it's, things like a bird dog. It's these core exercises that are not quite as burning, not quite as focused on that type of ab exercise, but it's more about strengthening that innermost layer. So those were super critical for me. Another thing was just stretching. So stretching every single day, and stretching not only the low back, but also my hips has made a world of a difference for my back, but also for my mobility, flexibility, and just everyday functionality. And then the last thing is movement, really of any kind, especially walking, but just being active. So what I found with my back, when I had periods where I had to stay still, so for example, in the postpartum period where you maybe are having to recover depending on, the type of delivery you have, that sort of thing, I always found that I just wanted to get moving appropriately, but I wanted to get moving as soon as possible because the more that I stay still, the more my back would flare up. And now, because I'm moving every single day because I have small kids, but I also do some sort of intentional exercise, stretching, deep core, every single day, that has helped really keep the back pain at bay. So those were the three things that really worked for me. And again, if you're somebody that found this video because you are struggling with back pain, talk to your doctor, get it worked up appropriately, come up with a plan. But these are definitely things you may want to mention to them or talk to them about and get their thoughts. Physical therapy is also another wonderful outlet that can really help with these types of chronic pain issues. So if you are somebody that is really excited about wanting to exercise more, wanting to move more, you're looking for exercise accountability, videos like this where there's information about how you might be able to improve or address certain things, tips and tricks for exercising more regularly or more consistently, definitely subscribe here so you don't miss any of these videos. I do this type of video weekly, but then I'm also here every single day in the shorts section doing little quick tidbits that I think are very helpful. And then also, I have a free newsletter, and if you're interested in signing up for that, looking for any of the stuff that I just mentioned, definitely head over to my website. The link is in my bio and it'll be in the description box. You can definitely sign up for that with your email. And I'm going to be sending out newsletters with all kinds of exercise tips, mindset ideas, positivity, support, all of that. So imagine if you're somebody that has chronic pain, whether it's low back pain or some other pain, and you were able to find movement activities or stretching or specific exercises that helped relieve that pain even a little bit. What else could happen? What are the possibilities if you were able to do that? Like I said, definitely come up with a personalized plan with your own physician, but this can unlock so many possibilities for you. Just think about it. Follow for more. Bye, everyone.